Hey guys, today we're gonna talk about lipedema and pregnancy. And let me write your questions below. Hi everyone. So one of the questions we get asked all the time is, shall I do my lipedema procedure before getting pregnant, after getting pregnant? If I get a child, how long shall I wait after delivery so I can get the lipedema done or the lipedema procedure done? So let's kind of make it clear and simple. The sooner you treat your lipedema, the better it is. The less chances you have on lipedema growth and overgrowth. Because what happens is with pregnancy, you've got hormonal changes. Hormonal changes, they advance lipedema. So I've seen it many times with my patients where they have a little bit lipedema around puberty, and really they started to notice that after their first child. So after the first child, the lipedema kind of progresses and gets worse. With the second child worse, third child, or depending on how many pregnancies, and then gets really worse with menopause. So the sooner you treat it, the better it is. And this is crucial. One of our patients was asking us is, well, let's say I'm pregnant, and obviously, if you're pregnant, you cannot have this procedure done. And I want to get it treated as soon as I'm done with my pregnancy. So you want to wait at least 3 to 6 months after delivery to be able to get liposuction done. And the main reason is to get your hormonal balance back to where it needs to. It really takes about sometimes up to a year after delivery for the body to go back to where it needs to be. But in general, you would do it at least at 6 months to a year. So again, the key thing is to get it treated the sooner the better, just to minimize advances of that. And what are the causes of what makes lipedema worse? Really extreme hormonal changes. So the first time we see it around puberty. That's kind of where the kind of lipedema starts showing up. So you got significant hormonal changes at that point. Then the second time we see it on pregnancy. Usually the first pregnancy, kind of patients say, I couldn't lose the weight. Now I have the weight in an area that no matter what I do, I cannot lose that. Then kind of and especially if it's tree trunk appearance of the leg, swelling, easy bruising. And sometimes we see a lot of hyperextensibility of the joints. We see that with lipedema patients. Autoimmune diseases are seen in lipedema patients. Resistant to diet and exercise, resistant to the weight loss, the new generation weight loss medications. So patients who are on those and where they lose the regular fat, but they're no matter what, I cannot get rid of the lipedema fat in my legs. Then in these cases, it's more lipedema. So with hormonal changes, you see that. We've seen it in patients who had ovarian surgery, kind of removal of the ovaries, because that affects their hormonal changes, and that advances their lipedema. So they would go from a stage 1 lipedema to a stage 2, or stage 2 to a stage 3. So these are kind of the changes you see. So first pregnancy, second pregnancy, ovarian surgeries, GYN surgeries can affect that. And then menopause. Really, the main hit we see it on patients is when they go through menopause, because now kind of the ovaries are shutting down, the hormones are shutting down, so kind of that advances them. And that takes us to talking about hormonal replacement therapy. And we had the physician with our life a few weeks ago kind of talking about that, and I do think that helps significantly. Now, would it revert lipedema? Unlikely, but could it potentially prevent the progression? Time will tell us if that would be the case, but it may, as long as we keep the hormones kind of regulated, so we minimize progression at the disease, especially around menopause. And that's something we need to think about. Patients having GYN surgery, then shall we have those patients on hormonal replacement to kind of make sure we keep lipedema fat cells at bay? And that's kind of where all the research is going to see kind of when is the right time, how to, what type of hormonal replacement to do, what are all those stuff to minimize advancement of lipedema. So I think got a question here from Sophie, and I'll try to answer these your questions as they come. So Sophie is asking, what at-home postpartum care can we apply for leg and arm lipedema? So that's a good question. So basically the question is, postpartum after delivery, what do we need to do at home? And the at-home stuff are usually non-invasive stuff, which are actually very helpful. Compression is key with lipedema, because it keeps the fluid away from the cells, and when the fluids are away from the lipedema cells, you have less fibrosis, less scar tissue, because it's a vicious cycle. So lipedema causes fluid buildup, and the fluid gets out from the cells to the outside. We call it extracellular space, kind of like outside the cells. That fluid that's sitting outside the cells causes fibrosis and scar tissue. Fibrosis and scar tissue causes more build out in the fat cells, because you have less return. The lymphatics are obstructed because you have less return, and that's how patients from lipedema, they end up having lymphedema because of the fluid and the fibrosis. So by maintaining compression at the arms and the legs, you're minimizing the fluid extravasation, minimizing fibrosis, and minimizing advancement of your lipedema. So definitely compression is key. You want to compress the area. The second thing that you can do at home is massage, kind of manual lymphatic drainage. Kind of you want to like start from the from the ankle and just kind of massage all that area. You kind of basically you're milking that fluid back into the lymphatics, back into the groin, so it goes back to the heart and kind of like starts that cycle again. So if you're at home and kind of like you don't have the resources of going out or taking care of your child, and you're this single mom, or whatever the reason it is, you can do those. At least those two things are crucial. The other stuff that you can add to it is minimizing sugar. Any anti-inflammatory diet is crucial, because when you eat low carb diet, low sugar diet, it does in a way kind of starve the lipedema fat cells, so you minimize advancement of that lipedema to advanced stages. So to kind of basically, in a nutshell, compression, manual lymphatic drainage, healthy diet is key, or lipedema diet, anti-inflammatory diet. There's kind of different things for that. I found with our patients that sugar has been really non-healthy for them in terms of advancement of the lipedema fat cells into advanced stages. So if anything, you want to just by cutting sugar, you're going to have significant improvement, and it's going to help on the regular fat cells also to kind of shrink them. And it's a vicious cycle, right? So kind of the more extravasation you have, and the more fullness of regular fat, it's going to obstruct the lymphatic on the lipedema fat. The more obstruction you have, the more swelling you have. The more swelling you have, the more obstruction you're going to have. And ultimately, you will have fibrosis. And then you go from stage 1, stage 2, stage 3, stage 4, and ultimately lipedema, lymphedema. So really early treatment, whether LippyLipo or whether at home, lymphatic drainage, compression, self-massage, kind of massaging that area to kind of get that fluid moved up, are actually crucial. It's going to help you minimize progression of the disease. Hormonal replacement therapy is key to kind of minimize kind of like those peaks and valleys of hormonal changes. So all these stuff are extremely important to minimize progression. Now you cannot go back in stages, but at least you can minimize progression of the disease. And these two things are extremely, extremely important. That was a great question. Hala is saying, doctor, please would you visit the DC sometime? Thank you. I only operate out of one location. So we do one surgery per day, and that's all what we do. We have one patient the entire day, and I operate out of one thing because I'm a control freak. So it's a good thing and a bad thing. And I just I have control over everything. I know all the stuff where they are. My staff is awesome. We know everything about our patients, and just kind of like we have control over all that stuff. So that's the way we do it. So I don't go from one clinic to another clinic to another clinic to another country and all that stuff. Our patients come to us, so we have that luxury, and it really allows me to get the best outcome possible, the best experience possible. So To us, it's really more about quality. We want to have the best quality possible on the product, on the outcome, and on the service for our patients. To be able to do that, I found that having it all in one place every single time, we have control over the delivery to our patients. If we kind of, every time I'm in a different state or in a different country, I will not have the quality control that I'd like to have. But that's kind of like my take on it. It's truly about the quality of the outcome. I mean, these cases, like today we're having a patient, she's flying to us from Colorado, and I'm excited to go see her. I think the girls are getting her ready for markings. So gonna go meet her, listen to her story, and then do the markings on her. And hopefully she's consented. We can show you her before and after and all that. And the cool thing about what we do, any patient that consents, we're showing the results. And this is how confident we are in terms of the outcome that we're gonna get. But that wouldn't happen if we were doing 2, 3, or 4 cases every day, because you gotta have to kind of move along. If you have the clinic where patients are waiting in the waiting room, and it just puts a lot of stress on the staff, on the surgeon, and on the patients. Like no one likes to wait. So basically, by doing just one case all day, one patient, all our time is dedicated for that. So we can take the time. Sometimes these cases, they take 4, 5, 6 hours to complete, just one case. And you think, oh my God, that's a lot of time. And it is. And the reason for that is sometimes we do the entire case with micro cannula. It's extreme minor sculpting, like using these tiny little cannulas that are curved. And that's what allows us to get these amazing results. The downside of that, it does take us the entire day to do that. So kind of like everything in life, you've got the pros and the cons. So to me, I'm a quality person. I like quality product. I like quality service. Just anything, I just love high quality. And the only way for me to do that was to kind of like just do one case a day, one location. And that's all what we do. So I don't have any plans on traveling to DC or any other state. Again, we're very lucky that we are in this position where pretty much all our patients fly to us. I would say more than 90% of our patients are out of state. They fly to us. There you go. I mean, that's kind of how we do it. The Dimovsky is asking, what do you think of grounding and red light? Good question. I don't know much about it to kind of, I don't have the data and the research. I'll look it up and get back to you on that on the next live. Let me write it down. There's a lot of things out there. I mean, that can potentially help. It's definitely something new. I would say, that would be my answer. I would say, do the basics that we know that they work. And if you're doing all the basics and now you need to take it to the extra level, then I will go to investing in more stuff. But if you're not doing the compression, if you're not doing the lymphatic drainage consistently, if you're not on an anti-inflammatory diet, all that other stuff is not worth it. So you gotta do the basics, like the foundation. We know, because we know those work. So if you're doing that and you want to take it to the next level, then yes, go to grounding and red light, all that stuff, and see what you can get out of it. But if you're not doing the basics, don't jump on the other stuff, because probably you're wasting your time and you're wasting your money. So you gotta do the infrastructure right. Bibi is asking, is the use of IUD good or bad? From a lipedema standpoint, it's really the hormonal changes. So I can't, that's more of a GYN question. But from a lipedema standpoint, really the key is to maintain your hormone, to be in a hormonal balance. The more balanced you are, the less progression of your lipedema you're gonna have. So that's crucial. So from an IUD, I mean, I don't see much hormonal changes on that. So I don't think it it changes much on the progression of your lipedema. I think what has the most control over progression of lipedema, treat it before pregnancy if you can, treat it before menopause if you can. The sooner you treat it, the better. The less extreme hormonal changes. I've seen it with patients with thyroid problems. Extreme stress can advance lipedema. So these stuff we know they advance lipedema. Pamela is asking, I'm Italian as can be, and let me get operated on by you. I guess you're saying that you're Italian and like to be operated by me. Happy to. Again, I don't fly to Italy, or we get, we got invited all the time to kind of go either give courses, operate, or do kind of procedures in Spain or in Europe. We just don't, because again, I love having control over the entire process, entire product, the service. We have everything in our location. I mean, all what we do is lipedema, so we have everything we need for LippyLipo. So all the instruments, all the stuff, and so to be able to deliver the best outcome possible, the best experience possible, I feel the best way to do it, in my opinion, is to just do it in just one place. So we know every single step, we kind of maximize it. We know how many fluid we need to get. We know the speed of the machine. I know exactly at what speed I need to run the machine to get the fluid in so the patients don't have any pain. I know exactly which type of cannula, which cannula goes with which tubing to which bag. What's the speed on the pulse machine. The suction the same. So all that stuff, like when you go from one place to another, they might have different tubing, different machine, different speed of the, and all that will affect into the quality of the experience that the patient is having. Here, I mean, I just know it, and my team knows it, and that's how we're able to have like consistent, amazing results with our patients. Good questions. I mean, really good. Bibi is asking, what's the difference between regular liposuction and lipedema liposuction? So they're very different. Actually, our patient from last week, she had liposuction to her lipedema. So she had regular liposuction for her lipedema. And she had it done by a plastic surgeon, well experienced, board certified, but not lipedema expert. So what they did is they did liposuction to the inner knee and liposuction to the inner thigh, and they took that fat and then they put it in the buttock area. Okay, so multiple problems here. The first problem, they did regular liposuction. So the problem with that, if you have lipedema, the fat is 360 degree. The fat doesn't fit in regular patients who don't have lipedema. They have fat on the inner knee and fat on the inner thigh. So they did the right thing by doing liposuction to that area if a patient doesn't have lipedema. But if a patient has lipedema, you cannot patch one area because they patched that area. Now she has a divot in that area, contour irregularities, because it's not that they did bad liposuction, they needed to treat the entire 360 degree. So when you treat one area, now all the other lipedema fat cells around it, now they look bigger than actually that area was treated. So now she has like those contour irregularities. She still couldn't wear shorts, she still couldn't wear a dress, and now she's more self-conscious about it. The other thing, that her lipedema fat was moved to another place. So kind of that potentially, okay, what's going to happen to that lipedema fat? We don't know. I mean, so multiple things there. So with lipedema liposuction, you want to do 360 degree lipo because the fat sits in a 360 degree fashion. So you want to treat it in a 360 degree fashion. So you're able to get the outcome that you want and to minimize progression of the disease in the future. Let's say she goes and gets pregnant in the future, or she goes through menopause. She was 42, so she's done with her kids. She has two kids, and then she was going to go through menopause. Now, even though she had liposuction by non-lipedema specialists, now her remaining lipedema fat cells are going to progress through menopause. So she paid for the procedure, she had contour irregularities, she wasn't happy, she didn't get to wear shorts, she didn't get to do the stuff she wanted to do. And now she came back to us for her lipedema surgery, And now we had to spend 6 hours on her case to be able to fix all the contour irregularities, to be able to do 360. And now she's feeling bad about it because like, you know what? I went to the wrong person and now I'm coming here so I can fix my problems. And it's just more time on us. It just like, it puts everybody in kind of like a bad situation in a way. Not a big deal for us. I mean, we would fix it, we'll go in. Yes, it took us 2 extra hours to get her where we need to, but we needed to do that to kind of fix all those stuff that has happened. So it's very, very important. If you have lipedema, make sure you get LippyLipo, lipedema liposuction by an expert who has done hundreds and hundreds of these cases. Otherwise, you're going to end up with not the outcome that you're looking for. And to fix those, it's very, very hard. And we actually, most of our patients who had like significant surgeries done by whether lipedema specialists or non-lipedema specialists, we turn them down. We don't accept them as a patient. So our ideal, most of our patients are patients who haven't had surgery done. Or if they had, it's like minor area, we look at it, because it's gonna take a lot of time to get it the way I wanna get it, where I can take the pictures and then post them and say, hey, I touched that patient, that's my patient, she looks awesome. So if we feel like patients, we cannot get them there, we just won't accept them as a patient. So in a way, by getting that, you will kind of like rule yourself out of being our patient. So I'll be extremely careful with that. And I'm not saying that to kind of like, you know, be mean or kind of like, I'm just saying that out of a pure heart. Really, you just don't want to mess that up. Especially if you first, you just want to go in. Already the lipedema fat is fibrous, is thick, is fibrosis, scar tissue. It's already a tough operation. You get it messed up, and now you go fix that, and it just makes it so hard. And it's very hard to get amazing results on that. So it's a totally different procedure. And that's the thing. And that surgeon was an amazing surgeon, amazing plastic surgeon, board certified. You name it. You gotta go to somebody. It doesn't, I'm double board certified plastic surgeon. I did general surgery at Yale, plastic surgery at Vanderbilt, and all that stuff. But put me to do a hand surgery or a hand fracture, which I'm fully trained for that. Would I get the same result as I'm doing lipedema liposuction? No. So you don't want to come to me for your hand procedure or for your facial fracture or whatever, like that I can do. You want to come to me for LippyLipo, but not for the others. So really be careful. So having the big CV, which, like a lot of people do, you got to see what the problem you have, and you go to the person who is best in the world of solving your problem. Not the other, or not like one person fixes all. Like, like the jack of all trades. You don't want that, especially in lipedema. Another area is like rhinoplasty. You don't want to go to somebody who does like everything. You just want to go to the guy who does that. Or whatever that thing is. The more, because there's so much variability within the body that, the right side of the body is different than the left side of the body in all of us, right? Imagine like one patient to another patient to another patient to, like you have 4 stages of lipedema, 5 types of lipedema, different quality. And so, there's so much variability. And if someone is not doing that all day, every day, that's all what they do, you're not going to get the result that you want. And that's going to, you'll go through the procedure, you're not going to get the outcome, you're going to have, the experience not going to be good. I can't tell you how many times you have patients, like this last week patient, it's interesting. She's like, oh my God, because she had it done awake by the other plastic surgeon. She's like, oh my God, it's just like, I was crying, all that stuff, and just stealing because of the pain and all that, and she just wants him to finish and that. And when she had it with us, she's like, I just didn't feel anything. So that tells you, it's not her body that's hypersensitive. It's just not the right experience, because not the right procedure was done. So one thing, you gotta make sure that the quality that you're getting, not only the outcome, is kind of the experience going through it, is the right experience. You wanna do it awake. I can't tell you how important it is to get it done awake. I used to do it under general anesthesia, and now I do it awake. It's a game changer. It's safer. Patients contract the muscle, relax, it shows me where the muscles are, I can sculpt it better, less risk of transfusions, less risk of pain afterwards. I mean, you name it, from any angle you look at, doing it awake is the way to go, no question about it. But doing it awake, it takes a different expertise on the surgeon side. So if the surgeon is used for general anesthesia and now they're doing it awake, guess what? You're gonna be in pain. You're not gonna have a good experience, and you're not gonna want to have it done awake again. I have so many patients like, oh, put me to sleep because I had something done awake and it was so painful. I'm like, let me tell you, let's do it awake and then we can talk about it. And then we do it awake, it's like, oh my God, like, that was like easy. It's easier than getting a tattoo, or it's easier than getting a mole removed, and because we perfectionize it. I mean, like, I tell patients, if you're having like any discomfort, you let me know. Like, I want to have it like 0. Now, is it 0? No. Is it 1 to 2 over 10? Yes. Now, some people are a little bit more hypersensitive. Some people have like 0. It's like chilling, FaceTiming with their friends. And some people that like, yeah, I feel this, I feel that. And we change cannulas, we change the speed, we change different things. But I'm talented for that, and I've done hundreds and hundreds and hundreds of cases for that, and that's all what I do, and that's how we're able to play at this level. It's kind of like, and that's how it is. Not everybody is a Michael Jordan in basketball, or whoever that person is. You have different caliber for different things. So anyhow, that's kind of my take on it. So the answer to the question, BB, yes, lipedema liposuction is totally different than regular liposuction. Pamela is saying, she's rephrasing her question. Thanks for it. Again, happy to do it, but I only operate here. I don't fly to other countries to do surgery. Iwa is asking, is it possible to have an online consultation and possibly qualify for the treatment because I live in Sweden? Yes, so the way it works, we have our link in bio. You'll put your information there, and then we get your photos, you get your patient paperwork, and then if you qualify, then we put you on for the consultation. Because a lot of patients, or some of the patients, might not qualify based on their history or based on their pictures. So pictures are very important, because when we look at the pictures, we know exactly if they have lipedema, what stage, what type, all that stuff. So the pictures are very important. So we do disqualify. We get about 400 inquiries a week, and we do only 2 surgeries. So you can tell, like, there's a lot of patients who end up not coming to us for multiple reasons. Either if they're not a candidate, if they're looking for insurance, we don't accept insurance. So depending on kind of what they're looking for. So we're very selective on whom we choose as a patient as well. And it's vice versa. Also, you need to be very selective on whom you choose as a physician. So it's a marriage. It really is between what you're looking for and what you're looking to get, and kind of vice versa. So it has to be a mutual relationship for both parties. Because it's a lifelong commitment. It's a big commitment to do those surgeries on both ends. Like, we put a lot of love and passion into it, and we would expect the same from our patients. So kind of like that's how we do it. So I'm scrolling down here to see if I. So here Bibi is saying, I already had regular liposuction, and my case is really similar to the one you described. Now I'm skinny but have these irregularities. Can you operate regardless of weight of the patient? I mean, that's a perfect example here, right? I mean, regular liposuction on a lipedema patient, they're gonna end up with like bad contour irregularities, right? Because the lipedema fat is very different, the fibrosis is very different. You need to use different cannulas, different speed, different that. So, and now you come here, and Bibi, I can't tell you how many patients we see in your shoes where they had it done. You look at them and you're like, oh my God. And some of them are not fixable, especially over resection. Okay, so let me make it simple for you guys. If you have contour irregularities, and if the contour irregularities is from over liposuction that's overdone, these are the hardest cases to correct, because you won't have enough fat. You're looking into fat grafting to the area. You'll have mottling of the skin discoloration. It looks like skin graft, skin adhere to the muscle. These are one of the toughest cases to correct. However, if your contour irregularities is from under resection of the lipedema, like the case that we've done last week, then it's easier to fix because I can use the fat in the adjacent area to suck part of it out, emulsify it, and then move it to the area that was over liposuction. So I can push the valley up and I take the hill down, and I spend a lot of time equalizing the area. So now I can bring them as close as possible together to minimize those contour irregularities. So it depends on the cause of the contour irregularity. If it's over resection of liposuction done by regular lipo from inexperienced plastic surgeon, then very hard to correct. If the contour irregularity is from under resection by somebody who's inexperienced with lipedema, it's easier to fix. Still hard, but it's easier to fix. Based on your question, you're probably on the harder part because you're skinny. That means you're over resected, and that's the thing that people don't. With regular liposuction, they use different cannulas. Different cannulas cause more contour irregularities. Lipedema fat cells are prone to more contour irregularities than non-lipedema fat cells. So, I mean, they go and the surgeon's like, okay, why am I getting this? Like, normally when I do it, I don't get this outcome. Now they get into a point where they cannot fix it. They don't know how to fix it because they got there because they don't know that they were taking the wrong path. So it's a very, very tricky position to be in. And I'm sorry you have that. You know, it's just, but again, you've seen it over and over and over again. And I tell people, like, do your homework, and do it right from the first time. It makes your life much easier on the long run. Carla is asking, I just came, and perhaps you have already talked about this, but does lipedema reproduce with pregnancy? Yes, lipedema does advance with pregnancy. And that's kind of, we were talking about that in the beginning of when we started, like, lipedema gets worse with pregnancy. With each pregnancy, lipedema gets worse. With menopause, it gets worse. So you gotta treat it the sooner the better. Now, if you're pregnant, about to get pregnant, you know, it is what it is. You know, you're gonna go through it, and then you're gonna wait about 6 months to a year afterwards to be able to get your liposuction done after it. Meanwhile, compression, manual lymphatic drainage, anti-inflammatory diet, low sugar, all that stuff to keep your lipedema fat cells at bay are crucial. Patient's asking about breast revision. We don't do breast cases. All our practice, we do lipedema, LippyLipo for lipedema patients, and we do only one patient a day. We're very, very concise in what we do. Just do one thing, and that's all what we do. And that allows us to be one of the best people in the world of doing it, because that's all what we do. We do it in one location. We don't fly anywhere else to do it. And Carla's asking, I'm from Barcelona. Where are you situated? We are 1 hour north of Nashville in the US. I think our patient is here, so I'm gonna have to go and mark her. But let's see if I can take like a few more questions. And kind of actually, I'll take this one. Do you do lipedema surgery on older women and then mid-60s? We've done it. The main thing with the patients who are above the age of 60 is their medical history, and mainly the heart, because you inject fluid to be able to suck the fat out. So you want to make sure the heart is cleared, is able to accommodate the fluid that's injected and the liposuction. That's really the main limitation with age. So most of the times we're getting cardiac clearance, we're getting kind of ejection fraction of the heart, just to make sure that it's okay. But yeah, I don't see any major contraindication. All right, guys, I'm gonna have to end it here. It was fun. If you guys have any questions, send them to me, and then I'll try to do more of these lives to answer as many questions as we can.